Hypertension, otherwise known as high blood pressure, is diagnosed in over 1 billion people worldwide. So that means it's very common. Let's start by defining it. Typically, it is represented by two numbers, a systolic and a diastolic blood pressure. The top number is the systolic blood pressure, which is the pressure in your arteries when your heart is contracting. The lower number on the bottom is the diastolic blood pressure, which is the pressure in your arteries when your heart is relaxing. Blood pressure is usually taken in a large artery in your arm called the brachial artery. We use the brachial artery because if the pressure is high in this artery, then it's most likely going to be high in all of your other arteries. Normal blood pressure is defined as having a systolic blood pressure less than 120 and a diastolic blood pressure less than 80. So, hypertension is diagnosed when the blood pressure is greater than 120 over 80. Now, why is blood pressure important to look at? Well, blood pressure, and especially high blood pressure, can cause some serious problems for your blood vessels because it can cause wear and tear on the cells that line your vessels in all of your body. Just like a garden hose that is under high pressure, your blood vessels can develop tiny cracks and tears that can lead to some serious problems like heart attacks, aneurysms, and strokes. You may be asking what causes hypertension. Now, about 90% of the time, hypertension happens without a clear identifiable reason. This type of hypertension is called primary or essential hypertension. In other words, pressure in your arteries starts to silently creep up. We may not know the cause of primary hypertension, but we do know the risk factors that can increase someone's chance of developing it. Thus, it is important that we're aware of them. I will go over some of them with you right now. First is lack of physical activity. Not getting enough physical activity as a part of your lifestyle increases your risk of developing high blood pressure. Physical activity is great for your heart and your circulatory system in general, and blood pressure is no exception. Second, an unhealthy diet, especially one that is high in salt. Good nutrition from a variety of sources is critical for your health. A diet that is too high in salt consumption, as well as calories, saturated in trans fats, and sugars, carries an additional risk of high blood pressure. On the other hand, making healthy food choices can actually help lower blood pressure. Being overweight or obese. Carrying too much weight puts extra strain on your heart and circulatory system that can cause serious health problems. It can also increase your risk of cardiovascular disease, diabetes, and high blood pressure. Next is drinking too much alcohol. Regular, heavy use of alcohol can cause many health problems, including heart failure, stroke, and irregular heartbeats. It can cause your blood pressure to increase dramatically and can also increase your risk of cancer, obesity, alcoholism, suicide, and accidents. Next is high cholesterol. More than half of people with high blood pressure will also have high cholesterol. Diabetes. Most people with diabetes will also develop high blood pressure. Next, smoking and tobacco use. Using tobacco causes your blood pressure to temporarily increase and can contribute to damaged arteries. Secondhand smoke, or exposure to other people's smoke, also increases the risk of heart disease for non-smokers. Stress. Stress is not necessarily a bad thing in and of itself, but too much stress can contribute to an increase in blood pressure. Also, too much stress can encourage behaviors that increase blood pressure, such as having a poor diet, physical inactivity, and using tobacco or drinking alcohol more than usual. Luckily, all of these can be improved with changes in our lifestyle, and these changes can help reduce hypertension. Now, in about 10% of the time, there is a specific identifiable underlying condition that is the cause of the hypertension. And we call this secondary hypertension. For example, anything that limits the blood flow to your kidneys can cause hypertension. Another important cause of secondary hypertension is atherosclerosis. This occurs when fat builds up in the wall of your arteries, which makes it harder for blood to pass through, thus causing pressure to build up in your arteries. Pregnancy is also another cause of hypertension. Now for the symptoms. Most of the time, high blood pressure has no obvious symptoms to indicate that something is wrong, and this is why we call it the silent killer. The best way to protect yourself are being aware of the risks and making changes that matter. But it's very important how high blood pressure can threaten your health and quality of life. It can cause certain conditions such as a heart attack, a stroke, heart failure, kidney disease or kidney failure, vision loss, and sexual dysfunction. Your best protection is knowledge, management, and prevention. First off, know your numbers. The best way to know if you have high blood pressure is to have your blood pressure checked regularly. Understand the symptoms and the risks. Learn what factors could make you more likely to develop high blood pressure and put you at a risk for serious medical problems. And lastly, make changes that matter. Take steps to reduce your risk and manage your blood pressure. Make heart-healthy lifestyle changes, take any medications as prescribed, and most importantly, work in partnership with your doctor.
We're going to be talking to you today about hypertension, also known as the silent killer.
In order to understand what hypertension is, you have to understand what blood pressure is. Blood pressure is the measure of the force that the circulating blood in your body exerts onto the walls of your arteries. Below is an example of a normal blood pressure reading. The top number, also known as the systolic number, refers to the force when your heart is squeezing and contracting. The bottom number, also known as the diastolic number, refers to the force when your heart is filling and resting.
Hypertension is high blood pressure. Here's a chart showing the different categories of blood pressure, ranging from a normal reading, which is 120/80, all the way to a hypertensive crisis, which is 180/120. And this is when it would be important for you to contact your doctor immediately.
Some causes of high blood pressure can include smoking, a high salt diet, obesity, stress, genetics, and sleep apnea. Some complications that can arise from having high blood pressure include things such as stroke, vision loss, heart failure, heart attack, kidney disease and failure, and sexual dysfunction.
There are actually usually no symptoms of hypertension. This is why it is called the silent killer and why it is so important to have your blood pressure read regularly. Towards the late stages of hypertension, some people do experience a pounding feeling in their head, dizziness, or chest pain. Your blood pressure can be regulated by using different methods, which include decreasing stress, not smoking, eating a healthy diet with lots of fruits and vegetables, daily exercise, and medication. So now you know the effects of hypertension and the importance of maintaining healthy habits.